This initiative is an opportunity to discuss what municipalities need from the province in order to build equitable, inclusive, and just communities across Ontario, something which is important to all of you here today, I'm sure. My name is Yvonne Kelly. I'm the current chair of the Social Planning Network of Ontario. We are a coalition of 13 planning councils, community development councils, resource centres, and planning committees located in various communities across Ontario. We have been in existence since 1991. Each of our individual organizations has their own mandate and boards of directors, but we are connected in our vision of equitable communities across Ontario and our mission to collectively act as a catalyst for social and systemic transformation. For today's event, we have a few housekeeping details. As previously mentioned, this session is being recorded, and if you choose, you can turn off your camera if you would prefer not to be on the video. Also, please remain muted for the session. It allows us to hear all of the speakers more clearly. I'd like to also request that attendees introduce themselves in the chat to us. Tell us where you're from in Ontario. There will be 5 speakers today from different parts of the province. Questions and comments will be taken after the 5 panel presentations. Questions from the audience can be directed to Israt Ahmed in the chat, directly to Israt, and comments are also welcomed in the chat. We ask that everyone speak to the issues and solutions without reference to partisan platforms and positions. Following the event, the video will be posted on Social Planning Toronto's YouTube channel, and the link will be shared with all attendees. Our speakers will have 7 to 10 minutes to present their thoughts, and they will receive a 1-minute warning from Israt when their time is almost over. So please remember to put your name and where you are from in the chat so we know who's with us today. And I will pass it back over to Melissa.
Thank you, Yvonne. I'm really excited for today's discussion. When we started planning this event, we thought that the provincial municipal funding and policy relationship might seem like a dry topic, but we've had over 200 people register to attend today's event. So like us, you recognize that this relationship is crucial to the issues and challenges that low-income and equity-owed communities across Ontario have been facing before, during, and post-pandemic. So I didn't get a chance to introduce myself earlier, but my name is Melissa Wong. I'm the Director of Engagement and Strategic Initiatives in a new role at Social Planning Toronto. Part of my role is to develop a shared vision with community stakeholders towards a just and equitable recovery, and so I'm pleased to be part of today's discussion and provide a platform for people in different sectors and regions of Ontario to share ideas and experience about what cities and regions need from the province to build inclusive and healthy communities. Today, we have speakers who will bring a range of expertise in emerging social issues from different regions in Ontario, such as homelessness in rural Ontario, rapid urbanization in Durham, public transit in Toronto, mass migration to rural communities, and mental health and addictions in the Hamilton region. Before we introduce our speakers, I'd like to share some information from a fact sheet and backgrounder that Social Planning Toronto has compiled, which focuses on the provincial municipal policy and funding relationship and the importance of this topic when it comes to realizing a vision for ending poverty, racial justice, and equity. My colleague Ishrat will share a link to these materials in the chat, and I'll share a few points from the backgrounder now. Like we said, the provincial-municipal relationship plays a critical role in shaping the quality of life, health, and well-being of our communities. Funding arrangements substantially determine whether cities have the resources to provide important public services, build essential infrastructure, and support equitable and inclusive communities. The Ontario government also determines the powers that cities have to raise revenue and set policy. Municipalities in Ontario are restricted in their capacity to respond to the big challenges communities face. Unlike provincial government, municipalities are required by law to balance their budgets. They can't take on debt to fund programs and services, and they have limited powers to raise revenues. Municipalities also can't introduce personal or corporate income taxes or wealth taxes, for example. I'll provide a few examples right now from Toronto that highlight the current state of affairs. The Toronto Transit Commission is facing chronic underfunding of transit operations, and we have lost significant revenue from a dramatic decline in ridership due to COVID-19. The TTC capital plan is short by more than $23 billion to pay for new vehicles and transit expansion. The Ontario government and the City of Toronto used to have a 50-50 sharing cost sharing for TTC operating costs, but that ended over 25 years ago, and it has not been renewed. And we believe it's time the province paid its fair share. Since the start of the pandemic, mental health problems and alcohol use have been on the rise. In the first 19 months of the pandemic, 835 people died from opioid poisoning in Toronto. The affordable housing crisis in Toronto has gone from bad to worse, with full shelters and many residents left with no safe place. Homeless deaths increased by 50% last year, driven by the worsening of the opioid crisis. We have almost 80,000 people sitting on the housing wait list for affordable housing, and 43% of those are coming from senior households. We also have 14,000 people waiting for supportive housing in Toronto. The City of Toronto asked for funding to open 18,000 new supportive housing units over the next 10 years, and we are still waiting for that funding. So what can be done? Our fact sheets explore some of the options that could support cities and regions to strengthen their ability to meet local needs, such as the power to implement fair taxation policies, as well as city charters that could enshrine municipal policy decision-making. So I'd like to move it over to our speakers now, who will talk more about the issues that are facing different regions in Ontario. Our first speaker is Chris Jordan Stevens. Chris Jordan Stevens is a social activist, writer, and researcher based in Huntsville, Ontario. His current focuses include community land trusts, disability advocacy, and housing first. He's a supervisor for the supported independent living program at Community Living Huntsville. He holds a PhD in philosophy and approaches complex problems in non-reductive and humanistic ways. I'll turn it over now.
Thank you so much, Melissa. Thanks for that introduction. And I think you set the stage well for my presentation. So I'm located a couple hours north of Toronto in cottage country. And in cottage country, we think of docks and, mansion cottages, which do exist. There's currently around 60 to 70,000 year-round residents in Muskoka. So thank you for giving me the opportunity about discussing some of the issues we're having up here that are actually very similar to those you just mentioned. So you asked me a really hard question, which was, how do we create just, equitable, and inclusive communities? And every time I talk about housing, usually it gets mired in a sort of a disagreement that the conversation then stops working. So, on the one hand, you've got demand critics. On the other hand, you've got supply critics. So for the purpose of this presentation, I've decided to not focus on those questions, and I'm going to focus on the issue of disability, inclusion, and housing in Muskoka. I'm also going to talk about homelessness and housing first in Muskoka. Now, I'm actually focusing, I would say, mostly on this: how do we build inclusive communities? That's what I want to focus on here today. Okay, so just a bit of a history lesson. I'm sure a lot of you know that I work with people with developmental disabilities that have that label. And, in Ontario, institutions have been closed. People with disabilities used to be housed in institutions. That used to be their home. And when those closed, they were, I think the last one closed sometime in the mid-2000s. In Muskoka, the most famous one was in Orillia, the Huronia Regional Center, which closed, I think, I forget the exact date. But then when the institutions closed, this idea of inclusion of people with disabilities kind of became the goal. However, people with disabilities were confronted with communities that lacked accessibility. There were a lot of barriers to access because they had no say in the actual development of these communities. Their voices were not part of the planning decisions that had occurred. So really, they moved from institutions with walls to those without them. And so let's take a look, I think, specifically at what we're seeing currently in Muskoka, and I think it speaks to a broader problem of inclusion in Ontario. So living on ODSP in cottage country. So ODSP, approximately somebody living with ODSP, they make around $1,100 a month. So currently in Muskoka, an average one-bedroom apartment is around $1,137 a month. Now, I should say during the pandemic, this has really increased because we've had a really substantial supply shortage of rental housing, and also a jump in prices of housing purchasing, largely because people are moving at great rates for retirement up to Muskoka, which is excellent, but it does drive the prices. And then additionally, you know, there's been historical routine exclusion of people with disabilities, people with labeled with disabilities from labor markets. I know some disability theorists go so far to actually argue that our current conceptualization of disability has a lot to do with organization of labor itself. But regardless, in the labor market, there's a lot of exclusion that's still happening. So if you put this together, somebody labeled with a disability and trying to get a job, an apartment, and live off ODSP, they're spending upwards of 90 to 100% of their income on housing, where 30%, I guess, is the typical goal. But that's astronomical, and so you know, you can't really find a home, an appropriate, adequate home, if you're someone with a disability and you're seeking to live independently. So what ended up happening when the institutions closed, a lot of people moved to geared to income and so community housing and public infrastructure. And in Muskoka, like in the rest of Ontario, there are a substantial waiting list that people with disabilities are currently facing. So they're really caught between, you know, spending all of their money to try to find rental housing, or waiting somehow 5 to 10 years. And so in Muskoka, I see at my work, a lot of people with disabilities end up in really precarious situations when it comes to housing. So my question is, you know, how is inclusion possible if people don't have access to adequate and affordable housing? I think of one really interesting case that'll kind of help me jump into my next quick topic, and that's that you know, we were working with a young person. This is kind of a conglomeration of people that we support. They were released from incarceration, and they were not given any sort of housing possibility in Muskoka, and they were put up in a hotel, which is an emergency form of housing people who are facing housing instability. And this person was sort of greeted by a lot of people that he knew from his past life in that setting. And so it was really not the appropriate place for him, and it really didn't set him up for success to become an included member of his community. And so the second part, the ask rather, is that, you know, I think we need to look at ODSP. There clearly needs to be more money, greater class mobility, and greater financial and housing security for people with disabilities. You know, faster access to rent subsidies, like the Canadian Ontario Housing Benefit is a good example. And community housing needs to be expanded or relieved somehow, because these wait lists are astronomical at this point. And so in Muskoka, we have seen a rise in homelessness over the last 8 or so years. Right now, there's just a reported 150 households. And, you know, this is in stark contrast to sort of the glamorous cottage country vision that we put forward. And you know, a lot of that housing is as empty most of the year. And so there's just it's hard to reconcile those two things for me. And I also think that, you know, in Muskoka, we have a lack of affordability, employment instability, because a lot of our work is seasonal, and we have really substantially high and rising housing costs. Additionally, because we're a rural area, we suffer from a lack of services, mental health services, disability services, employment services, and this kind of leads to this trifecta of housing insecurity currently in our area. So our approach to homelessness in Muskoka, we've made some really great strides. There's some emergency shelter, there's some transitional support. There's a Home for Good program that just started in Bracebridge, and my understanding they're doing some really excellent work. However, I still think there's a lot of gaps in our approach. I'm going to skip ahead a bit, but we need to, currently the province is mandating enumeration reports, but leaves homelessness strategies up to the municipalities. My understanding, though, is that housing first strategy is sort of uncontroversially the best strategy, and there's different ways that housing first there can different permutations of that strategy. Housing first, for those, I'm just going to give a quick, I'm sure all of you are familiar. The idea is, you know, you house people first and then you build supports afterwards. And in fact, those supports are only effective to the extent that people have stable housing. And that's what we've been finding at Community Living Huntsville, that the people we're supporting with disabilities, if they're experiencing homelessness, we can't actually provide the adequate support that they currently require. So what I'm trying to work with my district right now is to really promote a housing first model, which hasn't happened in a lot of rural areas. I know there's a lot of city models for this, but that's currently what some of us are working on. So I've used up my time. Thank you so much for listening, and I will stop sharing and mute.
Thank you, Daniel. I'd like to introduce our next speaker. Our next speaker is Sheila Pizzi Allen. She's the Executive Director of TTC Riders, a membership-based organization of transit users in Toronto. TTC Riders has recently won a campaign to convince councillors to transform the Scarborough RT corridor into a dedicated busway when the RT closes in 2023, so replacement buses don't get stuck in traffic. Now they are campaigning for more bus service, bus lanes, and other improvements to keep Scarborough residents connected after 2023. Welcome, Sheila.
Hello, everyone. Great to be here with you. Before I jump into a presentation, I wanted to ask if people wanted to share in the chat or even put up your hand, who in our session today has been taking public transit during the pandemic? If you feel like sharing, there's no pressure to share. But I see a couple hands. That's great to see. I know things are kind of, more and more people are getting out and about taking transit these days. But I wanted to ask because, our answer to that question actually says a lot about where we live. Not everybody is living in a city in this session. So some of us may not have adequate transit service, but also what we do for work. If we've been able to work from home or if we have to go into a frontline job every day, what our income level is, so if we can even afford to drive a car, and also for racialized or not, because more racialized people have been taking the TTC and public transit during the pandemic. So great to see your responses in the chat too. And would love to hear more about your experience as we go as well. But I'll ask Beth to go back to my slides if you would. I don't think I need to explain to anyone here that transit has been a lifeline during the pandemic. And so even if we haven't been taking it ourselves, we've all been relying on it in the sense that it keeps essential workers in our city moving and has been really critical. So I think it's a really important time to be changing the way that transit is funded, changing the relationship of the province, because more and more people see how important it is and that transit is a right. So I'm going to be speaking about how it's important to a fair pandemic recovery and why stable operations funding from the provincial government is so key to that and so important to boosting service levels, but also how the relationship to the province has changed, especially in Toronto. So I think what I'll be saying is relevant to municipalities outside of Toronto with the funding piece, but in Toronto in particular, we have less and less say at our city over what gets built in Toronto and other elements of our transit system, like our fare card system. So I just wanted to share a quick story that was sort of referenced in the introduction about a campaign that we've been working on to just give an example of what the relationship to the province, but also hopefully to excite people about how organizing can move our issues forward. So last year, if you go to the next slide, for people outside of Toronto, we learned that this important transit line in Scarborough, the Scarborough RT, will close in 2023, and a subway extension to replace it won't open until 2030. So 35,000 Scarborough residents will be taking replacement buses for at least 7 years. And so TTC Riders did outreach to thousands of residents who use the Scarborough RT. We surveyed 300 people. And if you go to the next slide, We launched a report. We found that the majority of people did not even know that this line is closing. So there's a real lack of information, news and political literacy about what's happening with transit in our city. But when they found out, the overwhelming majority wanted to keep it as a busway. And we were able to convince the TTC to do so thanks to our organizing. On the next slide, you'll see an event we held just last weekend where we invited all Scarborough provincial candidates to walk a red carpet. It's supposed to look like a bus lane, and pledge their support for more bus service because that replacement bus service when the RT shuts down is still not funded. And the TTC is asking the provincial government to provide the operations funding. We also asked provincial candidates if they would support free transfers between GO and TTC. There's 7 GO train stations in Scarborough, but most people can't afford to use them because they have to pay a double fare. And also if candidates will support funding for the Eglinton East LRT. In 2019, the province passed Bill 107 and took over the delivery of 4 Toronto transit projects. The Eglinton East was not one of those projects, even though it's one of Toronto's priorities. So it's sort of fallen off the map, even though Toronto has put $1.2 billion into it. So this gets at some of the, who's in charge of Toronto transit questions, the role of the province, but also a story about how organizing works. And you can go to our website, ttcriders.ca, if you want to see which candidates ended up signing that pledge. So I wanted to go back to the question of who's riding transit and how do we recover from the pandemic? So on the next slide, you'll see, this is a photo of an empty subway. Transit ridership has dropped significantly during the pandemic, but not everywhere in our city. So buses have actually still been quite crowded on some routes. And I've already mentioned that there's been a few studies about who's riding transit. The majority of people riding are racialized, essential workers, earning lower incomes, more likely to have a disability. And I wanted to share the story of someone involved in TTC Riders. She's a frontline worker, works in a shelter in Scarborough, and she ended up spending a lot of money on Ubers early in the pandemic because she didn't want to take a crowded bus. So on the next slide, I wanted to show where is the bus crowding happening. So if you're familiar with Toronto, these bright yellow lines are where overcrowded buses were observed. This is a map from spring 2020 that the TTC put out. And the crowding is happening in areas where more racialized working class people live, also going through, industrial areas. It shows how important more bus service is, but also the connection between transit, housing, and gentrification. So people who can afford to stay home and work from home are also people who can, afford higher rents and property along the subway lines, right? There's not that much crowding in the middle of the map along the subway lines. And that's why, we need strong community benefits and affordable housing at any new transit stations that are being built and existing ones. But the bus ride, and also, people are, although the transit ridership overall is still just over 50%, the bus ridership is over 60%. So it's a really important part of the system. And so speaking of ridership, on the next slide, I wanted to show, why is operating funding for us the key issue we think that the province needs to play a role in. Toronto is that longest band, and our rider fares usually pay for 2/3 of the operating budget. So that means with the lower ridership during the pandemic, Toronto lost a significant source of revenue. And if you go to the next slide, so Trisha Wood isn't here today, but she created, is one of the contributors to this report by Code Red TO. It's a different way to think about this. So if riders are paying most of the operating budget, the subsidy is quite low. And the black bar in the middle is the TTC. That's how much subsidy per rider the TTC receives compared to other Canadian and American systems. And again, the TTC is quite an outlier in terms of being underfunded. The province used to provide 50% of the operating subsidy, but this was ended in 1998 under the Mike Harris government. And that's why fares have continued to rise faster than inflation, because riders are, the cost has been downloaded to riders and the city of Toronto. So I know I'm actually almost out of time. So I think that maybe I could just actually flip ahead to The last slide, I think it might be interesting to know for people here in Toronto, but also other systems that have the Presto Fare Card. And it's just another example of, I talked about the importance of operating funding, but also in terms of the role the province is playing, it's starting to make more and more decisions about local issues, such as the fare card system. Toronto wanted to have a different kind of fare card system, but Presto was imposed on Toronto. And this map shows where you used to be able to buy TTC tokens in red versus where you can load your Presto fare card now. And there's huge gaps, especially in the Northwest and in Scarborough. And this impacts people who don't have access to online banking. Just imagine you have to walk half an hour to go and load your Presto card. It's really limiting people's access, and it's limiting people's access in the suburbs the most.
Hello.
Yeah. So I know this is something that impacts other municipalities as well. So be interested to know how that's playing out for you. But just to sum up, we really see operations funding as the key issue. We're looking the province to play more of a role in, and that's how we're going to be able to boost service, make fares more affordable, and also boost paratransit service. So in Toronto, that's Wheel-Trans, which is, there's a policy change at the TTC where some people will be limited in the door-to-door Wheel-Trans service that they can book. That's because of a lack of stable funding from the province for operations. So I think I'll wrap up there just because I know I'm out of time.
Thank you so much, Sheila. I really appreciate that overview. Next, I'm going to introduce Sue Phipps. Sue is the Chief Executive Officer of the Canadian Mental Health Association, Hamilton branch. Sue has 16 years of clinical success as a registered nurse, serving people experiencing serious mental illness, problematic substance abuse, and homelessness. Sue holds a Bachelor of Science in Nursing and a Master in Health Management from McMaster University. She's co-chair of the Mental Health and Addictions Adult Secretariat for the Greater Hamilton Network. Sue, happy to have you here. Please unmute and join the video.
Okay, thank you so much. Hello, everyone. So I'm coming to you today, as noted, from Canadian Mental Health Association Hamilton branch, so CMHA Hamilton, which is a not-for-profit community mental health organization serving adults 16 years of age and over with serious mental illness and addictions. And we've been in operation for 56 years. We are one of roughly 30 branches across Ontario, and CMHA also has branches across Canada. In Hamilton, we provide intensive case management services, mental health court support, social and recreation services, and primary care for people experiencing homelessness, psychiatric consultations, peer support, supportive housing, and mental health promotion and education. And we do all of this with just under 50 staff. Our staff are predominantly social workers, nurses, social service workers, recreation therapists, and people with lived experience. So we are small but mighty, and we are tired. So slide 2, please. And so we have 3 asks of Ontario. And the 3 asks are to invest in the front lines, prioritize health equity, and address the opioid crisis. Slide 3, please. So I'm going to speak firstly to investing in the front lines. So why? So burnout is reported by 61% of mental health and addictions workers, almost as high as nurses at 66%, compared with 23% on average in other professions. And why are mental health and addictions workers burning out? Likely because of vicarious trauma and grief and loss due to responding to opioid overdoses and suicides. And the pandemic, as it has progressed, we saw an increased demand for intensive services and an increase in acuity in our clients. And these factors increase the emotional labor required in this work and the health consequences of emotional labor for our staff. Retention and recruitment of staff is a serious concern for our sector. Mental health nurses and social workers are leaving, seeking higher paying healthcare jobs, or leaving the professions due to burnout. They are feeling underpaid and undervalued. 66% of resignations in our sector over the last 2 years were salary-based, and many CMHA branches haven't received base funding increases in 5 or 10 years. we are asking for an 8% base increase. Early in the pandemic, driven by a recognition of how vitally important the mental health of our staff is, we launched the Emotions Matter Project, which is a research project led by Dr. Diana Singh from McMaster University and CMHA Hamilton. And we surveyed over 500 staff from CMHA branches across Ontario to understand the impact of the emotional labor associated with their work. We have now created an online course for participating branches to help mental health workers build coping skills and resiliency, and we will also be developing a peer-to-peer support program to enable staff to share their stories and to support one another in the workplace.
Sue, please call reception. Sue, please call reception.
Sorry about the interruption. We cannot keep doing more without more resources. We need time within the workday to debrief and support one another, to process the difficult things that we see and hear daily in this work in order to keep doing what we do well. We need Ontario to demonstrate to our community, mental health and addictions workers, that they are valued within our healthcare system because they are vital to the health and well-being of our community. So slide 4, please. Ask number 2, prioritize health equity. So 80% of Ontarians expect the province to be in a mental health crisis when the pandemic is over, and we need the province to acknowledge this and address this. At CMHA Hamilton, total numbers served jumped from 12,500 last year to 18,300 this year, with no increase in funding. And remember, we have less than 50 staff. Our number of unique registered individuals served has doubled from last year. Our wait list for intensive case management is now 2 years. This is unacceptable. As one example, Ontario needs to invest in free, accessible, evidence-based therapy for post-traumatic stress disorder to address the underlying causes of mental distress and problematic behaviors. Individual trauma therapy is offered within the private sector, but it's not accessible for most of our clients. We also need free, racial-informed, culturally inclusive therapeutic modalities to address trauma for all racialized people, including refugees and newcomers arriving to Hamilton from war-torn countries. Ontario also needs to reduce disparities related to the social determinants of health and population health. These pertinent factors, education, poverty, housing, racism, and others, affect people far upstream from their interactions with the healthcare system. Social assistance rates need to be increased to address health disparities related to social determinants. Increases should include funds for internet and cell phone service, which are now basic necessities for accessing care, education, finding employment, and being included in our community. We need more purpose-built supportive housing for people with serious mental illness and substance use issues, and particularly for people using toxic illicit drugs like fentanyl and crystal meth, so that they can be successful in remaining housed. 24/7 supports within housing should include peer support, harm reduction supplies, supervised consumption space, naloxone distribution, and safe supply. This is also part of ask number 3. Slide number 5, please. Ask number 3 is address the opioid crisis. In Canada, a total of 26,690 apparent opioid toxicity deaths occurred between 2016 and 2021. Toxicity of drug supply is the driver. 86% of overdoses in 2021 involved fentanyl. It was a crisis before the pandemic, and COVID-19 made things worse. In Ontario, men 25 to 44 years old account for the greatest proportion of emergency department visits, hospitalizations, and deaths related to opioids. And as if the suffering from the addiction is not enough, people who use drugs are criminalized for behaviors caused by their illness and so often incarcerated. Decriminalization would be a just step to reducing the harms of substance use. This map shows the concentration of opioid-related Hamilton paramedic service incidents between 2017 and 2021. Hamilton paramedic service response for suspected opioid overdose jumped from approximately 47 per month in 2020 to 76 per month in 2021. Hamilton needs dedicated funding to coordinate our local drug strategy. The Hamilton Drug Strategy is an evidence-based, comprehensive approach to address the harms of substance use, which include 4 pillars: prevention, harm reduction, social justice, and justice in treatment. Under-resourced community organizations like ours cannot effectively coordinate this essential work going forward, and our system needs to be better coordinated and integrated as a continuum of health and social services for people who use drugs. So in summary, CMHA Hamilton has 3 asks of the province to support the mental health of our community in pandemic recovery: invest in the front lines, prioritize health equity, address the opioid crisis. Last slide, please. So CMHA Ontario has a campaign in light of the provincial election, I Choose Mental Health and Addictions. So please join me in choosing candidates in the upcoming election that commit to investing in community mental health and addictions care. Hashtag I Choose Mental Health MHA, sorry, hashtag I Choose MHA. Thank you. I apologize for the interruptions. I'm gonna have to just leave for one moment.
Before you leave, Sue, thank you very much. That was very informative. Before we move on to our next guest, we would like to just remind people that as you're hearing these incredible presentations, I'm sure it's sparking lots of ideas and questions. Don't leave those to the end in terms of not forgetting them. Please put them in the chat. And put a direct direct message to Israt, who's taking care of that for us, keeping track of all the questions. So do that along the way so that you don't forget those questions. And thank you for remaining muted during the presentation so that everyone has a great listening experience. And now I'd like to introduce Joy Angelique Agrez. Joy is the social researcher at Community Development Council Durham, an independent not-for-profit social planning organization that has been working to enhance the quality of life for individuals, families, and communities in the Durham region for more than 50 years. Joy's education and professional background are in social work and public policy, with a focus on advocacy, community development, diversity and inclusion, gender equity, and research. Welcome, Joy.
Thank you, Yvonne, for that. I'm just going to share my screen here. Okay. So yes, thank you for inviting me to speak a little bit about the Durham region and its relationship with the province. I'm just going to jump right into it. So like Yvonne had mentioned, we're an independent nonprofit social planning organization working to enhance the quality of life for our various community members. So we're also a multi-service organization. So some of the communities that we serve include immigrants, newcomers, and refugees, people experiencing housing issues and homelessness, as well as children and youth. We're quite a large organization with multiple departments, giving us the capacity to provide these services to our different community groups. So for instance, a lot of our newcomer services will come out of our Ajax Welcome Center, and our housing services will come out of our housing department. So a little bit about the Durham region, just to give a fuller picture of what we're looking at. So the Durham region is huge. It's 980 square miles, making it a huge geographical jurisdiction. We stretch from Lake Ontario in the south to Lake Simcoe in the north. Durham region is comprised of urban centers like Ajax and Pickering, as well as your more rural and remote communities like Brock and Schoolog. And there's definitely more people living in the south, and population is a little bit more sparse in the north. We're one of the fastest growing regions, so we're expected to grow to 1.3 million by 2051. And while we're experiencing this general population growth, we do have a growing newcomer and homelessness population, which I'll discuss a little bit further in the presentation. I'd also like to note that there are these sort of distinct and growing differences and disparities between North and South Durham, like access to services and supports, funding to these different organizations that provide these services, and general income disparities as well. So speaking to the growing migration to the Durham region, so thousands of people are migrating to Ontario and moving to Durham for many reasons. For instance, looking for affordable housing or looking to have greater access to some of the social services and supports that are out here, or looking to escape some of the challenges of living in a metropolitan and urban center. For instance, the living wage here is around, I think, $18, and in Toronto, I think it's 22. As mentioned previously, we have a growing population of newcomers, and especially with the pandemic and the different crises that are happening around the world, we've definitely seen that increase, especially here at CDCD, where we're having a lot of folks trying to access our newcomer services. And newcomers can access many barriers to accessing services, but especially here in Durham, for instance, accessing affordable childcare, transit is another huge thing, which Sheila had talked about, but this is an issue everywhere in Durham region. as we don't have as many buses, trains, or stops in Toronto. I know those have been cut, but and this is even more true for North Durham, right? So where services are already quite sparse and they're already really spread apart. And also people who've migrated to Durham may not be able to access the municipal or provincial services at all. So healthcare, safe and secure employment, housing, so these sort of pieces. In Durham, there's only 2 welcome centers. So us, Ajax Welcome Center, and the Pickering Welcome Center. So there's definitely a need for more provincial support to meet the demand of the newcomers that are coming into our region. And with this growth, we'd also like to ask the province for support with building this general and social infrastructure to ensure that the folks who come into our region have a really enhanced quality of life when they come here. So a little bit about housing and homelessness. So in Durham, we're seeing the creation of bedroom suburbs. So from Durham, people can commute or drive to the city, so Toronto for work, and then they can come back. However, in these suburbs, there's limited or no general and social infrastructure to support the folks that are living in those communities, which I had touched on a little bit previously. And overall, the development and growth of these new suburban areas with the limited infrastructure, it's very clear that they were kind of made for profit and not necessarily with families and people in mind. And according to our 2021 point in time count, for folks who aren't familiar, it's a count and survey of homeless individuals on a single night. Homelessness has doubled in the region from our count in 2018. So from 291 in 2018 to 573 in 2021, which is a massive increase. Again, with the region being so diverse in its geography, it was impossible to count everyone, particularly those who may be in those rural and remote communities. So the numbers that you see here on this map we expect are actually much higher. And this is really just sort of the tip of the iceberg of the issue of homelessness in Durham, because again, it's hard to account for hidden homelessness, folks who may be couch surfing, people who may be hiding in these rural and remote communities. And with the pandemic and the significant impact it's had on livelihood, again, this number is likely much higher than what we see here. I'm going to speak a little bit about Durham's social service infrastructure. So organizations and nonprofits are seeing increased demand, which I had talked about, like us at CDCD. Unfortunately, we have insufficient and limited infrastructure to fully and holistically support our communities. CDCD has been working on bridging the gaps between North and South Durham, but there are lots of challenges there, as I'm sure you can imagine, like competition for funding, limited services, isolation, and the general nuances and experiences of living in the North that living in the South, we're just not able to capture the same. And according to our research into the impact of the pandemic on nonprofits, the pandemic has a massive impact on Durham organization, especially our grassroots and small organizations. And participants have expressed the need for more adequate funding and the need to work together in order to adequately recover from this. So what needs to change? I'm gonna kind of skip over a little bit. I'm running out of time, but in general, in regards to Durham, the province must provide funding and better planning for general and social infrastructure here, as well as consider our unique geography and growing population. So considering the urban center pieces and the rural remote communities and the diversity in that. In regards to newcomers, some of the suggestions that we have is allowing access to all provincial and municipal protections and supports, regardless of status, and expanding pathways to permanent residency. For instance, leveraging Ontario's immigrant nominee program. So that's open to workers in all occupations in all sectors. And then in regards to housing, so create affordable housing that remains affordable in the long term and supporting people in maintaining their housing. So for instance, providing supports like legal supports for tenants at landlord and tenant board hearings. This is especially relevant, I think, for newcomer people where there's already barriers in place. or in terms of agriculture, protecting farmers from foreclosure. In terms of our social service infrastructure, increasing paid sick days, increasing wages for frontline service providers. In turn, the province would be investing in women who make up a majority of the sector, and of course, investing in the nonprofit sector in Durham as a whole, and encouraging organizations to collaborate in their recovery. And that is it for me. I will wrap up there.
Thank you so much, Joy. It's great to hear from everyone the kind of the similar conditions and issues, but the unique circumstances in each of the different regions. So thank you so much. Next, I'm going to invite Joelle Lamport Lewis to join us. Joelle has 20 plus years of leadership experience in the charitable sectors. Joelle demonstrates a passion for social justice issues with a commitment to change. Joelle leads transformation with compassion and collaboration. She brings strong management and leadership expertise to organizations and uses complexity, strategic thinking, and passion while building learning cultures to drive outcomes. She uses evidence to support decision-making and is known for an ability to scale impact. Thank you, Joelle, for joining us, and we look forward to your presentation.
Great, thank you, Melissa. So let me work the magic of presentations. Okay, wonderful. So I'm here today to talk about the urban to rural migration that we're experiencing and the importance of provincial municipal dynamics in particular. So a little bit of context for us. Our population of Ontario is 14.9 million. Toronto is 6.3 million, and Perth Huron is almost 154,000. We span across 135 towns, with our largest small city with just over 33,000 people in that Stratford, Ontario. The gray area here is representing Perth Huron. The blue line is Toronto, and the right of the screen are those that identify as female, and the left are those that identify as male. And this is by age. So what's notable here is that Perth Huron, on average, is an older demographic. So we're complicated, we're complex. So we have 17 municipal entities that include lower tier government, single tier, and county level jurisdictions, often with competing interests. Additionally, we have 2 provincial ridings, both that cross outside our municipal and county jurisdiction into Perth, Wellington, and Huron-Bruce. So here you'll see some demographic shifts from urban to rural. There's 60,000 children and parents leaving Toronto and Peel in 1 year to southwestern Ontario. The majority of that population are young families with children, and the reasons for this shift have been noted as magnified due to the pandemic, and mainly because of housing, better quality of life, green spaces, and the ideology that you drive until you qualify. So qualify for those housing options. Here in Perth still, even though we're seeing the younger populations leaving the urban centers and coming to southwestern Ontario, they're typically not coming into our smaller jurisdiction yet, and primarily because of our lack of housing options. We're seeing a bit more, of course, of that, but we still have a significant baby boom generation, and we attract the over 55 age cohorts as well in our jurisdiction. It's a beautiful place to live, but this has significant implications to the well-being of our communities as well. So why migration to small and rural communities matters in Ontario? There's opportunities to build stronger, more equitable and healthier communities with this population growth. And that is through our upcoming provincial and municipal elections. It's the opportunity here to clarify roles and accountability. One size does not fit all across Ontario, as you saw with just our sheer population bases. Policy decisions Funding agreements are often established without consideration to rural communities' needs. However, there's consequences to those actions. We're facing significant financial concerns with population shifts. There's direct concerns around infrastructure like healthcare, long-term care, care facilities, transportation. Municipalities are faced with decades of downloading costs from federal and provincial governments and responding to increased pressures like affordable housing, community safety and well-being, etc. Respect local and regional differences. The cost of delivering services are not the same across the province. A review should analyze costs on a per capita basis and take into consideration differences between the regions like rurality, pandemic impacts and inequalities, improvements of equitable service and service integration for positive social economic impacts need to be considered. Opportunities for the first time in 2 years to look ahead at future challenges, the aging population, health needs, workforce gaps, and the need to take a holistic approach. The opportunity to rethink the federal, provincial, municipal relations. There's political will to do so. So let's take some action towards establishing those relations. It's a great place to start to build a more inclusive and just community. Thank you.
Thank you so much, Joelle. So we've reached the question and answer period. If you haven't already, please submit your questions to Ishrat in the chat. And I'll just remind everybody, we're and panelists as well to we do want to keep this as a nonpartisan event. So we want to focus on the issues and the solutions. So I'm going to start with the first question to all of our panelists. It's a question from a seniors advocacy group. So the past 20 years has seen a sectioning off of senior services in the name of more age-friendly services, but we're finding that more often means less service overall. For instance, income security, over 1/3 or nearly 1.5 million Ontarians are eligible for GIS or gains, which mean that they are living on $1,600 or less a month, but expected to pay market rent with fewer spaces for senior-specific housing. Multiple assistive devices and other programs, each with its own co-payment or user fee, other issues like rising costs of transit. Can any of, so invite our panelists to speak to that. Does anyone want to go first? Joelle or Joy, do you want to speak to maybe what you're seeing in Perth, Huron, or Durham?
Christopher also had his hand up.
Oh, Chris, sorry.
That's okay. I mean, I can't speak too much to this in Muskoka. However, like Perth, Muskoka is very much an older community. There's a lot of people who've retired here, a lot of people, so yeah, an aging population, and we have also limited healthcare resources. So we're really struggling with senior housing that's accessible. And sadly, in the worst case scenario, there's people who could potentially be living at home for longer if they had adequate support in the community, but they end up in hospital as alternative level of care, and which is a problem in itself. But we're seeing that problem in all throughout Muskoka for sure.
I can maybe jump in, Melissa, if you have time. Yep.
Definitely.
Yeah, I agree. Christopher sort of spoke well for our circumstances as well. I think that there's some opportunities here, especially that we're seeing around, we have housing issues, transportation issues, the same issues everywhere. But I think there's innovative solutions to looking at policy decisions that don't necessarily focus on our senior population, but where we relieve pressures in other cohorts that will help out all populations. So, we're thinking about housing options, right? We have policies that restrict, granny flat solutions, accessible builds that are, more inclusive building structures and things like that, where if we could minimize those pieces, it would allow for all of our populations to do better, and it allows access for our senior populations to leave those 3,000 square foot homes to other facilities, and also allow those young people that we desperately need to come and work in our healthcare systems, because we're seeing hospitals close temporarily or restrict emergency services because we can't maintain those staff. So we need those housing options that are there. So I think we have to look at this from a holistic perspective, as opposed to one particular cohort, and feature our focus our policy or our decisions on one specific area, because I think for our region in particular, we can't afford not to attract our younger cohorts. So focusing on senior policy will actually not help us in that full spectrum.
If I could just jump in, Melissa, if that's all right, to just add on to what Christopher and Joelle was saying, I totally agree. I feel that taking a holistic approach, looking at more fuller picture. I mean, I can share a story about a senior that we had heard about from our North Durham organization, right? Where, like I mentioned during my presentation, the transit system is not great here in Durham, and services are already so far and in between. So yeah, for instance, the individual was trying to access dental services, and it was a whole day excursion to just get to and from this particular appointment. So I think taking that wholesome approach, for instance, investing in transit, so making sure that there's more buses available, that there's more stops available, so that senior folks who need to access and take transit can do that in a more accessible way, I think is a good approach.
I can just jump in too. So yeah, I absolutely agree with all of those comments, and sort of taking that look at the bigger picture, right? And I think in Hamilton, we see, people waiting in ALC beds, waiting for other beds, right? They're in hospital, they're an alternative level of care. They could be supported in long-term care, for example, but they just don't have the beds, or they don't have the staffing. We have PSWs, who previously would have been providing home care, leaving the profession because of gas prices. They can't even afford to drive to do their work. So, I think we really have to think about solutions across the cohorts, as Joelle was saying. And I remember learning about sort of a housing affordability project that was also meant to address seniors and loneliness, because we know that ill health, is tied to loneliness. And so they had students who needed housing living with elderly people who needed to have that loneliness piece addressed. And it turned out to be a really successful project. So I think, because our communities, we don't support our elders in the way that maybe we once did, with sort of living with our, intergenerational families and so forth. I think we have to think outside the box now and try to, build that into our existing system to meet the needs of both young people and our elderly.
Thanks, Joy. Actually, I'm going to go to the next question, and I think this question is for you. Why is development directed to wetlands and watersheds instead of the municipalities under housing pressure? So it's a housing question, if you want to start, and anyone else who might have anything after that can add in.
Sorry, Yvonne, is that a question directed towards me?
It was, yeah. So if you wanted to take that one, and then if anyone else has anything to add, we'll
Sure. Sorry, do you just mind repeating the question once more?
I sure can. Not a problem. Why is development, so housing development, normally directed to wetlands and watersheds instead of municipalities under housing pressure? That's the question. If we need clarification, we can ask whoever asked that question to put it in the chat.
Yeah, it would be great if I could get a little bit more clarification on that, or if anyone would like to kind of jump in as well.
while we wait for that, maybe I will go to the next question that I have, and we'll see if we get some clarification on that. This question's for Christopher. Temporary residents such as wealthy cottagers benefit greatly from the loveliness of Muskoka. Do they have a responsibility to contribute to the solutions and of the housing crisis? What should and does that look like, Christopher?
So I should say that they do have an obligation, and they actually, I think the vast majority of them actually agree with me. We have a lot of active cottager community members who contribute greatly. Now, what it looks like, though, I think is part of it is getting a deeper understanding of local year-round life. The difference in Muskoka between July and August and the middle of winter are drastically different for the people who live here. And I really think that they need to have a good understanding of the economic profile of Muskoka and the issue. So I think a lot of it is they need to, and we also need to, as locals, work more collaboratively to sort of understand the issues. And because it's very easy to see the middle of August, like I said, come to Muskoka, everyone's welcome. Like, it's a great time. But the middle of winter is something else. And the pressures that families are facing are quite extreme. And those are also part of, I'll just say one more thing that I think is a bit more informative, which is that we cannot economically reproduce our workforce currently in Muskoka. So we need workers to come here to work seasonally to keep cottage country running. However, people cannot work here for those jobs and find a place to live. So as it currently exists, we cannot finance cottage country for very much longer. And so that's the other bigger issue, is that we need to have longer term labor and be able to actually attract people, because cottage country requires the service industry, and people can't afford to work in that industry and live here.
Joelle, did you have your hand up as well?
I did. We're seeing the exact same thing as Christopher in our region as well. But I think we have incredible cottage dwellers that do great things in our region for sure. But there's opportunities for us to look at accommodation taxes and things like that, right? Where it can bring an infusion of economic and social development into our region as well, right? That some municipalities already have this, but there are those sort of opportunities for us to capitalize also on that, and put it into affordable housing development, right? So you can allocate those dollars specifically to the development of those housing solutions also. So, I think there's some opportunities here too, because what we saw with tourism, and I'm sure Christopher, I'm not speaking for you, but I'm sure you did as well. Tourism didn't stop necessarily in our region because we have so much green space. And beaches, and it's beautiful, right? So we saw a significant elevation of tourism during the pandemic as well. So that is up. They couldn't eat anywhere. They couldn't use the washrooms, of course, but we didn't seem to see that burden necessarily. But it does. But there is an opportunity for us here.
Thank you both, and that's really interesting, Chris, that you're seeing that kind of support from some of those with the property owners in the cottage country. So that's great to see. I'm going to move on to another question, and I think this goes out to all of you. So in Ontario, there are 6 majority minority cities, or also could be called racialized majority cities. So those are Markham, which has almost 78% racialized communities, Brampton 73%, Richmond Hill 60%, Mississauga 57%, Ajax 56%, and Toronto at 51%, almost 52%. How can we leverage the input from racialized residents in these cities? Does anyone want to go first? Oh, Sue or
Yeah,
Sue or
sure.
Joy, do you want to take some?
So, I mean, Hamilton is not one of those identified cities, but I actually grew up in Mississauga, so I'm familiar with it. I think, when we're talking about inclusivity and, creating a community that is inclusive, we need to have those voices at the table. So we need to be co-designing services and, any number of needs within the community with those voices. And I think in order to build trust and to engage the voices of people who are racialized, I think you do need to find those champions that people, that represent the people who need to be included more into, whatever it is that they are not included in. So I think that's really the first step. I'm not articulating that very well. I'm so sorry, but really it's about, leveraging those voices and having them involved in co-designing.
Yeah, just to kind of add on to what Sue said, I totally agree. I mean, like I said, Durham is seeing an increase in newcomer folks coming into the region. And I think leveraging those voices will be so important when we're trying to plan and we're creating these services and supports, but also trying to understand what their potential barriers might be, right? Trying to understand those and how we can break them down and what supports they would need, what supports in place they would need to, for instance, even feel comfortable accessing services. So I think, I think newcomer voices at the table will be absolutely necessary going forward.
Yeah, like I know that we've been looking at this in different ways in mental health as well, and kind of creating like very specific, Black mental health services led by members of the Black community here in Hamilton, and engaging that community to learn about what are the things that traditionally might be utilized to support people's mental health. And it may be completely different than sort of what the Western medicine model looks like, right? So we have to really think about, how do we do this in a culturally sensitive way? And the only way that we can do that is to engage people in that process.
Yeah, I totally agree. So I think that cultural safety piece is huge, and really acknowledging people's experiences and the identities that they bring to the table and how that informs how they go on in their lives and the different things that they need.
Thanks for all those great contributions. We have so many good questions coming in. I know we're not going to have time for all of them. The next question is one on affordable housing. With the spread of housing and the housing crisis to rural and small towns in Ontario, as we've heard today, it's important to note that there's just simply too little affordable housing supply. So the question is, how can we get small town and rural partners, where many government members get elected, mobilized to press for affordable housing investments? And I can repeat that question if necessary. There was a bit of a preamble. Essentially, the question is about how do we get small town and rural partners, where many governments get elected, mobilized to press for affordable housing investments, as the move outward and the need for housing pretty much everywhere is growing.
I can maybe start that, Yvonne. Thank you.
Thanks, Joelle.
I think this question is one that's plaguing many of us on a daily basis. Clearly, the interesting piece here is that our culture in small and rural communities tends to be that single detached home is the success factor. We built that ideology probably 100 years ago, right? With the idea that you wanted that plot of land and you build out from there. I think that what we really need to do is think about our education around what is actually happening. Our millennial populations, our Z, like we've got this sort of trajectory that's happening that looks different than what we grew up on. So we've got to educate our public. We see the not in my backyard, the NIMBYism pieces where our politicians are having to react to the volatility of those conversations. It's the wrong conversation to be having. The conversation to be having is really around community improvement, not around an individual build on a street, and asking the neighbors what they think, because they don't know what they're reacting to, right? You're asking them what they think, and they'll tell you, but they don't exactly know what that means. There's no evidence to say that there's, a property value goes down because there's a build of X number beside. Like those things, we've got to dispel those myths to some degree, but the focus needs to be on talking about community development, not individual development. So I think that we have to change the conversation, and politicians are reacting to the public's abstention around what's being developed, and yet they don't want to see homelessness in their backyard either. So I think if I could really encourage our politicians to just talk about this in a different way and progress people along instead of getting bogged down into the reacting to the issue at hand. I don't think that answered the question, but I maybe skimmed it.
I think you can go ahead, Chris. Yvonne, you're just on mute.
Just to echo Joelle's point, focusing on particular developments kind of obfuscates the real issue. One of the greatest assets we have in Muskoka is just the amount of land we have. And what we're looking about is ownership structure, land assemblies, solutions to property ownership that can be replicated throughout the community. So it can be, we're not looking at we're looking at land trusts and cooperatives as being part of the solution, because land is really a very powerful, thing that we have and we want to keep within public reach. I think we need to protect our land in that respect. That's all I wanted to mention.
Thanks. And Aaron, I know I won't say your name correctly, but it's Aranza? Your hand is up?
Yes, I feel like maybe it was with less government intervention and removing some zoning restrictions. For example, there is some places that they in some neighborhoods, they don't allow like the triplex or duplex, even the granny houses, that is a very affordable, a small way to help too. And I think that it's very important that they're going to bring progress to everybody, because they're going to be maybe an income for somebody in the house, one small little granny house, or maybe a duplex or triplex going to help somebody with some money. And another thing that I see, and it's like that, in my view, it's more easier to ask for funds than to change policies. And I think that is very, very something to think about, because it's like it's very hard to do changes without to have some kind of opposition. In my view, I don't belong to any organization, but I am an immigrant, and as an immigrant, the majority of people, and the people in Toronto are immigrant. We came here from another place, and the immigration bring progress, bring new jobs to people and new energy too. So even these small towns, they are bringing more energy. We are bringing funds, because most of the people, for instance, I work, and everybody where I work, most of the people, they have houses, they have second houses. They are always thinking in business and to do this one, to do the other thing. So that brings some kind of energy. Do you know what I mean? Like, yeah, that is I know that you were talk about more holistic way. That's just my piece of.
No, those are excellent points, because it's not just one simple solution, right? It's policy changes. It's also mindsets, and particularly to Joel's point, the mindsets of those who've been here for many years and have formulated this fantasy of a single detached home, and the larger the better. So I think it's a bit of both, because with mindsets and attitude changes, hopefully we can influence those politicians who make the policies. Is anyone else wanting to catch in on this one? I think we'll move back. Melissa, you've got your next question then. Thank you for everyone's responses.
Thanks. And I think this one is directed to Joelle. what is Perth Huron and other smaller communities, so anybody else can jump in as well, doing to ensure inclusiveness and equity for their community? How can you promote these rural places, such as like newcomer services for these communities?
We're struggling, to be quite honest with you. And there's a lot of progress with committee structures across the board in healthcare, police services, in even manufacturing. We're seeing a lot of work being done and a lot of internal eyes on their own policies, processes, procedures, operations that's being done. However, it's not yet reflective in community. So lots of times we hear, you know, small towns are so nice, they're great places, but I would say we're far from being welcoming in a way that we need to be. And I think we have some good intentions, but we have a lack of understanding of what needs to be done, how to do it. There's will to do it. They just don't know what to do and how to do it. And we often want to, you know, bring people into our colonial approaches to things. So we bring people in and say, okay, we want to attract and include diverse populations and come in and do it with our tables. But what we desperately need to do is co-design new tables that start from a place of where the issue is at, or the concern or the opportunity is to progress forward, because then the ownership looks different, the collaboration and the collective response looks different. But to be quite honest with you, we've got a lot of work to do. And we've now received a bit of research from the University of Western Ontario with our Immigration Partnership Network to sort of play it out for us that we are not doing well and we need to do better. So the good news is there's interest and desire. I think we lack sort of that know-how, and it's a long process.
Thanks, Joelle. I think what you talked about is really centering people in the middle of that, and bringing people in as much as possible. Joy, did you want to add to that?
Yeah, I just wanted to really just echo what Joelle was saying. I mean, we are struggling as well in Durham. I mean, again, with us being so large and being so diverse in our geography and urban versus rural, there's a lot going on here. So there's definitely lots of work to do. I mean, there's immigrant services, but really there's only 2 welcome centers in the Durham region. So like I said, it's us and Pickering, right? And if we're considering, you know, this growth in population, newcomers in the area, that's not going to be enough going forward. And if we're our population is projected to increase as it is, yeah, 2 centers is definitely not going to be enough, and they're going to need more supports in order to have the quality of life that we'd like to see, and that they came here for, right? So yeah.
Okay, we're going to wrap it up with a question that can go to any of our panelists, and it's a little bit getting into the specifics. So overall, how can the province better support municipalities and local organizations to serve their local communities? That's not the specific part. That's a pretty wide open question. So we're asking our panelists, do you have any specific provincial policy changes that can benefit local communities? As we head into a provincial election, having some specific policy changes that we're looking for can be very beneficial to all of us. So anyone can start.
So
we heard a few ideas. Sorry. Yeah, sorry. We heard a few ideas. Sorry, Sue, go ahead.
Yeah, I just wanted to comment that there was an amazing discussion on CBC around housing issues. I think it was last weekend. And they were talking about shifting like the ability for the government to set some restrictions on the purchasing of properties and to look at housing less as a commodity and more as a basic need, right? So I think that we need to do more of that and to look at, like, we do have, you know, private investors coming in and buying up properties and then not doing anything with them, and they sit unused. And if we could prioritize, say, for example, not-for-profit, similar to what, you know, Joy had identified, to be able to purchase those and to create a continuum of housing to meet the needs of our communities. I think those kinds of solutions could be really powerful, but I think we do need the government to step in to support those kinds of policy changes.
Thanks, Sue. Anyone else on any other policy or legislative pieces?
I already mentioned it in my presentation, but I do think we need to review the Ontario Disability Support Program and the funding structures that are really keeping people at or below the poverty line. That's one thing that I feel very strongly about.
Thanks, Christopher. We were hoping you would say that. Joelle.
Yeah, I think that there's this need to identify where the province can take over, legislative mandates that are higher level, that keep municipalities out of getting into the weeds and the responding to individual concerns. So I'm not going to identify specific policies. It gets very political fast, but I do think that there's opportunities to sort of determine which level of government does what. And for what opportunities, because we're in a really interesting place in time where we have the ability or the interest of government to look at this differently around red tape and things like that too, right? So who's going to do what to alleviate pressures at the municipal level? We're downloading things to municipal levels that maybe could be staying at the provincial level, and vice versa. So where do municipalities need to take on the ownership of delivering certain aspects of things? There's provinces that do things differently too, and look at other jurisdictions that we can really take advantage of. I mean, there's tons of planning policies that we can get into that are provincially mandated or legislatively done. I mean, that gets messy fast and it's slightly different in every region, but there's real opportunity to make those slight changes to decrease affordability concerns and things like that would certainly alleviate our populations. Income is a major issue. Basic income, there's a whole world of things I can get into around that. Our living wage opportunities that we really desperately need to see government step up and into to make the province more equitable, to be quite honest with you.
I already mentioned in my presentation just stable operating for transit, and it's not something that only impacts Toronto, right? We heard about Durham Region where fixed routes were cut and shifted to on-demand during the pandemic, and so we really need that stable funding to increase service and increase access, and also for paratransit, so for accessible transit services. And then the other piece that touches more the GTA is democratizing Metrolinx, the provincial agency where provincial decision makers, they don't, we need to say locally about decisions that affect us, and they're not always as responsive to local concerns, like the Presto example, but there's many other examples.
Thanks, Sheila. So we had a lot of great suggestions in the chat, and I'm sure all of you had other ones that you would have mentioned. And so just a few to capture: the return to the 50-50 funding formula with the province, a province-wide vacancy tax to address the speculation pieces. And it's not just about foreign ownership, it's more of an issue with speculation right here in our own country. That other one is a bit of a red herring, but what's happening with real estate investment trusts is a huge issue. Housing is not a commodity, it's a human right. Livable incomes, and returning our minimum wage to where it would have been, and making it further adequate, or making it more adequate. I'm going to do a very quick attempt at a summary. I don't even know if it's necessary at this point. I think that last question really did capture a lot of what people were thinking. I think what we've seen throughout today, and I kept a lot of great notes if anybody's interested, but some very critical pieces of, you know, how costs have been downloaded, and in the absence of adequate funding for things like anything from healthcare to housing to opportunities and adequate incomes for individuals, the costs aren't just downloaded. The costs that are already at the municipal level are exacerbated. So we need strong provincial partnerships, critical and reliable operational funding, not just for transit, for other pieces. And we need to recognize that people are moving out from the center. They're moving out from the core of downtown Toronto. They're moving into even further beyond the GTA. So what does that mean for people in areas like North Durham and in Oxford County? So we have newcomers, people who are moving as far as they can to afford what they need and to be able to be able to settle, and yet the services have not been able to keep up. So investments in infrastructure. I think that's where I'll stop, because I want to give us a chance to really thank everybody who's been here with us today. Amazing conversation, and you will be able to see this once the link is sent out for the YouTube channel. So back to Melissa.
Thank you so much, Yvonne. So I just want to give a quick thank you to everybody that participated today. Thank you to my co-moderator, Yvonne. You've been amazing. Our speakers, Chris Jordan Stevens, Sheila Pizzi Allen, Joelle Lamport Lewis, Sue Phipps, and Joy Angelique Agres. Thank you so much for all of you for joining today and for sticking it out to the end. And I'd also like to thank our organizing partners, of course, Social Planning Toronto, Network of Ontario, Community Development Council of Durham, TTC Riders, the Social Research and Planning Council of Perth Huron, and our Social Planning Toronto team, Jen, Beth, Saroja, Lisa, and Marion, especially Ishrat, for doing all of the stick handling to get us to today. Thank you so much, and I hope you have a wonderful rest of your day.